Well, good afternoon, everyone. It's a real privilege to be here with you today, albeit remotely, and have the opportunity to share some of PCORI's perspectives on digital phenotyping and personal sensing. So I'm Jason Gerson. I'm a senior program officer in PCORI's program for clinical effectiveness and decision science. And next slide, please. So nothing to disclose. Next slide. So here's a high-level overview of my remarks for this afternoon. I'll introduce PCORI as a funder of patient-centered comparative clinical effectiveness research, or CER. So as a funder, we primarily fund randomized trials, cluster randomized trials, and large observational studies, and studies of other designs, hybrid designs as well, and implementation designs. I'll speak briefly about PCORI's national priorities, looking to the past, present, and future, and what these priorities mean for research involving digital phenotyping and personal sensing. I'll characterize some of the digital phenotyping and personal sensing interventions in PCORI's current research portfolio. I'll speak to that both in terms of our clinical research portfolio and our methodological research portfolio. I'll talk through some considerations and challenges for funding research involving digital phenotyping, particular to PCORI, and then I'll orient you to some upcoming funding announcements. So this symposium is taking place at a time when PCORI has very recently adopted a set of new national priorities for health, and we are in the process of refining our research agenda in light of these priorities. These activities have important touch points for how PCORI thinks about digital phenotyping and personal sensing as emerging innovations. I'll say at the outset here that I'm here today not as a subject matter expert, but as a representative of a funder, and a funder with a particular remit to fund comparative effectiveness research that distinguishes itself from other funders of basic and translational science whose interests are largely on discovery and establishing efficacy. Next slide, please. And next slide. So here's a 30,000 foot view for those of you who may be unfamiliar or less familiar with PCORI. We are an independent research institute authorized by Congress in 2010, and we're governed by a 21-member board of governors representing the entire healthcare community. So it's a broad array of payers, disease foundations, and other patients and caregivers and organizations that represent them. So it's a pretty wide cross-section of those participating in the healthcare system and community. We're, as I said, primarily a funder of comparative clinical effectiveness research with a particular flavor of CER that engages patients and other stakeholders throughout the research process. And through our research funding and other activities, we seek to answer through our funded research studies real-world questions about what works best for patients based on their circumstances and concerns. Next slide, please. So drilling down a little further on the characteristics of the CER that PCORI funds, our funded research studies generate and synthesize evidence comparing benefits and harms of at least two different methods to prevent, diagnose, treat, monitor a clinical condition or improve care delivery. It's intent on measuring benefits in real-world populations and describing results in subgroups of people, so an emphasis on heterogeneity of treatment effects and such analyses. It's intended to help consumers, clinicians, purchasers, and policymakers make informed decisions that will improve care for individuals and populations. So a real focus on a clinical decisional dilemma is critical in our research studies. It considers the patient's needs and preferences and the outcomes that are important to them, most important to them. And we also fund, and I'll say a little bit more about this in my remarks, we also fund methodological research to improve the rigor and conduct of patient-centered outcomes or research, or PCOR and CER. Next slide, please. So I won't belabor this slide too much as it makes some of the points I articulated on the previous two slides, but suffice it to say Since its creation in 2010, PCORI has had a mantra of research done differently, and has sought to change elements of the clinical research enterprise to make it meaningfully relevant to the practice of medicine and meaningfully inclusive to a wide array of patient, caregiver, and stakeholder perspectives. Next slide, please. So with respect to patient-centeredness in the research, PCORI defines this as a kind of research that answers questions or examines outcomes that matter to patients within the context of patient preferences. And I'll say that we should not take it as a given that all digital phenotyping or personal sensing data are de facto patient-centered. While they're certainly patient-generated, patients and study participants have nuanced views about the importance of that data to their health status and the health outcomes that matter to them. This point underscores the importance of doing meaningful patient and caregiver and community engagement to learn about what these priorities may be and to fold these views into the conduct of the clinical research we fund. Next slide, please. And next slide. So from a research funding perspective, the first chapter of PCORI's existence was framed primarily around the national priorities for research, which are listed on this slide. First is what the assessment of prevention, diagnosis, and treatment options. We shorthanded as assessment of options. This is kind of our more generic, broad strokes comparative effectiveness funding program. And so it's really just at its foundation compares the effectiveness and safety of alternative prevention, diagnosis, and treatment options. The improving healthcare systems compares health system level approaches to improving access. So through it, we support patient self-care, innovative use of health information technology, care coordination for complex conditions, and effective workforce deployment. So those studies are frequently have a cluster randomized designs. Our communication and dissemination research supports shared decision-making between patients and their providers. Our Addressing Disparities program seeks to advance equity in health and healthcare by supporting CER that identifies options for reducing and eliminating disparities in populations at risk of health and healthcare disparities. This can include racial and ethnic minority groups, rural populations, people with low incomes or low socioeconomic status, individuals with disabilities, lesbian, gay, bisexual, and transgender people, and people with limited English proficiency, to name just a handful. And finally, there's the Accelerating Patient Outcomes Research and Methodological Research. We shorthand as the Improving Methods Program, which is intends to fund projects that foster methodological improvements in the conduct of CER. Next slide, please. So through the funding announcements framed around the priorities which I just described, we've funded dozens of projects that have included digital phenotyping, personal sensing, and wearables, either as part of the intervention strategy or as the cornerstone of that strategy. The examples on this slide, which include wearables to measure daily step count, stand hours, sleep durations, accelerometers, continuous glucose monitoring devices, digital platforms to record patient-reported outcome data, among many others, are meant to be illustrative and not exhaustive. And I'm happy to provide more information about these particular projects or others. They're very easily searchable at PCORI's website through a search engine that's built into the kind of search our portfolio function in it. So, and happy to speak in more detail about any of these. Next slide, please. So beyond our portfolio of clinical research, we've also funded methodological work related to digital phenotyping. This includes a recently funded project titled Studying Methods for Ethical and Human Subjects Protections Issues in Digital Health, PCORI-CER. So the main objectives of this project was to develop and evaluate a risk management tool to help identify digital health research risks and benefits and to better manage those risks, and to design consent processes that may lead to better informed consent in digital health research. We also have a methods funding announcement for those of you that may not be aware of this. So this includes, this is the method's funding announcement is issued in just about every funding cycle. So our current programmatic priorities include methods to support data research networks and methods to improve use of AI and machine learning in clinical research. And as you can see from the project that I briefly characterized, we also have a programmatic priority around ethical and human subjects protection issues. By and large, the first two priority areas around research networks and AI and machine learning, there may be many opportunities of interest to this audience that are relevant to assessing dimensions of data quality, approaches to integrating heterogeneous data sources, as well as approaches to handling missing data, among others, that may be responsive to the method's funding announcement. I'm happy to speak more about that should there be any questions about it. Next slide, please. So as I noted earlier, PCORI has very recently adopted a set of national priorities for health, which will set the stage for our research agenda in the years to come. The priorities reflect the input of a wide array of patients and stakeholders whose input was gathered through numerous convenings, as well as a public comment period. These priorities are listed on the slide, but for the purposes of my remarks today, I'm going to focus on the increasing evidence for existing interventions and emerging innovations listed at the top of the slide. To be clear, there's no implied ranking of the priorities by the ordering you see on the slide. PCORI sees these priorities largely as co-equals. So PCORI aims to strengthen and expand ongoing comparative effectiveness research focused on both existing interventions and emerging innovations to improve healthcare practice, health outcomes, and health equity, including both emerging innovations and existing interventions to close evidence gaps. Will expand the impact of PCORI's evidence generation, dissemination, and implementation efforts. PCORI defines emerging innovations as interventions with some evidence of efficacy, but not having yet achieved substantive translation into care. They are often characterized by significant uncertainty in their evidence or appropriate use due to incomplete examination of populations, conditions, care settings, outcome measures, or comparison with existing interventions or approaches to care. So innovations in health and healthcare include new and improved health practices, policies, systems, products, technologies or services, and delivery methods that have potential to transform care and improve health through increased effectiveness, efficiency, quality, safety, and affordability. As innovations emerge, evidence of their potential benefits and harms is typically incomplete and uncertain, as is their comparative effectiveness relative to the landscape of existing interventions. Once identified, promising innovations need to be assessed for their potential to improve outcomes and evaluated to determine the comparative effectiveness relative to existing interventions and the evidence used to discourage, encourage, or selectively target further adoption into practice. Next slide, please. So PCORI is and will continue to pursue a number of strategies to address this priority. These include monitoring the research landscape for potentially high impact innovations through horizon scans and evidence mapping activities that we do in-house, studying the unintended consequences, adverse events, barriers to care, burdens and economic impacts, and widened disparities in care outcomes associated with the existing and emerging innovations. Expanding the scope of stakeholders engaged in PCORI's work from topic inception through implementation of the results. Emphasizing the inclusion of populations who are underserved, underrepresented, and disadvantaged in current CER research endeavors. And finally, supporting CER of evidence gaps in diverse populations, geographic areas, and settings to foster equitable uptake of practices. So PCORI believes that evaluating a range of innovations from clinical care interventions to system changes and innovations in healthcare delivery, as well as new technologies and products, including those related to digital phenotyping and personal sensing, have the potential to inform health-related decision-making and improve healthcare delivery and patient outcomes. Next slide, please. So as we pursue these strategies, the types of research we want to fund will come into sharper focus. In many respects, this will build on the research we funded in our first decade, research that optimizes and links the full range of data resources to gain a more holistic view of patient health and healthcare. This includes research using optimized real-world data, including non-traditional sources of patient data, for example, wearables, that promotes accessibility, quality, privacy, transparency, and standardization, and to identify individual differences in responses to different interventions focused on disease prevention, management, and treatment. It's research that seeks to integrate health information systems, namely linked EHRs, health information exchanges, among other things, and enhances the integration of social determinants of health data in large-scale platforms for utilization in CER. And it's research that utilizes PCORNet, which is our national network of networks, as a national resource to generate definitive evidence through studies of national scope for the public good. These are some of the features of the research we're hoping to fund. And it really, as I said, builds on a decade of funded research studies that we're hoping to extend into the next decade and beyond. So next slide, please. So equally important, PCORI seeks to fund research that uses data representative of diverse patient populations and settings to generate more inclusive evidence. So some of the characteristics of this type of research are research that utilizes a more complete and comprehensive set of patient-provided information representative of the entire US population. Research that provides evidence of effectiveness for interventions delivered in non-clinical settings such as the community, home, school, or workplace. Research that recruits study participants that are representative of communities most affected by health disparities through partnerships with these communities. Research that's conducted in limited resource, rural, or safety net settings. And finally, research that involves investigators that reflect the population or community where the research is conducted and for whom the research is intended. Next slide, please. So I'll conclude my presentation by highlighting a few considerations and challenges with respect to digital phenotyping and personal sensing that PCORI is thinking through. So one is, as I said, as a funder of CER, innovations as interventions must have some evidence of efficacy to be included in PCORI-funded clinical CER research. And reasonable people can disagree about the robustness and relevance of that evidence, excuse me. So, as we consider letters of intent and applications, there are often conversations we have with investigators or applicants about the level of evidence that's available at the time of application. These are fairly robust, interesting conversations that we have. And, I think I would say, as I'll amplify at the end, that we welcome your inquiries and conversations, and you can reach out to me if you should have questions about this. With respect to cost and sustainability, so in general, PCORI will not cover costs for study interventions that constitute the procedures, treatments, interventions, or other standard clinical care that are being proposed for comparison in the research project. Such requests are sometimes made by applicants, and when they are made, PCORI carefully considers and scrutinizes them by considering the following questions. One is, would the research or the study be possible without PCORI's help with the intervention cost? Is the study taking place in an under-resourced setting, serving understudied populations? Are the magnitude of the cost relatively low with respect to the overall proposed budget? And finally, is there good stakeholder engagement and potential for sustainability and scalability should the study have positive findings? So these are all considerations that PCORI has grappled with, we continue to grapple with, and we always welcome conversations with investigators and applicants about these. Finally, a couple of remarks about through a health equity lens. So one is, for PCORI, as we think about have even a greater lens on health disparities and health inequity, we're mindful that health inequities may be perpetuated if the data used to make health decisions is not representative. and the technologies that are being used in our studies are spread inequitably. We're also mindful that different lived experiences, culture, social position, among other things, influence the adoption of these technologies, that we may need tailored approaches if we're ultimately to achieve digital health equity. Next slide, please. So just a word in conclusion. So on this slide, and you can see the link to our funding opportunities page. We'll have, as the 2022 year approaches, PCORI typically has 3 funding cycles per year. There's a wide array of funding mechanisms to support both clinical research and methodological research. So a lot of information can be found here about the upcoming opportunities. And again, I'm happy to speak more about them either in this session or should you want to reach out. So I think with that, I'll conclude. I think the last slide just has some contact information for me and for PCORI writ large. So with that, thank you for your attention. I'm happy to be here with you. Thanks.